Alright guys, so I'm going to talk about the plantar fascia. So plantar fascia pain, plantar heel pain, plantar fasciopathy, they're all interchangeable terms that describe pain in the arch of the foot. So going from this area down here around this is the calcaneus bone, the heel bone, just forward from that, so usually it's in this area, slightly in front. So it can be related to a tendon related type issue through the plantar fascia itself. So this area here. You can also have heel pain, okay? And the heel pain can be related to the gel cushion around it. There's shock absorbers and cushioning around the heel bone, and they can become sensitive. Is that right? So they're like a fat pad around it, and they can become very sensitive if irritated. That could be happening from a change in footwear or like a stomping the heel down the ground. So we have to differentiate between the plantar fascia from the mid-arch situation and the one from the heel, which can be easily done. Now, the other very important things to consider, and you'll get this in our guide, is the big toe extension. So that ability for the big toe to come up like this, because if that big toe only stays down here and can't go up to 70 degrees, okay, in that archy movement, that doesn't activate naturally the windlass mechanism, okay? So that's a fancy name for the stretch response that props up the arch through here due to the fact that the big toe is flexible. So when we walk, you walk heel to heel strike, foot flat and toe off. And during that toe off period, it activates that plantar arch windlass mechanism, which stabilizes the foot and arch, okay? If that's not present, then the strain gets shunted on somewhere else. Next thing, so that's the big toe. The next thing is the ankle joint. Here we need to make sure that the ankle joint hinging is good, okay? So that has enough what's called dorsiflexion, ability to go up like this. This model is just very stiff. So like it goes from here up to here, and is there enough dorsiflexion to allow that ankle hinge to move properly? Okay, so that can be related to the joint itself or tightness in the calf up here, all right? So we check the tightness in the calf. And is that related to tightness in the calf itself? Is it related to an Achilles tendon issue, or a combination of multiple of these things? So as you can see already, that's four different things that we need to assess, and that's not the be all and end all by any manner of means. And we can easily check that in an assessment. Getting to the real root cause is the absolute fundamentals to get this right. Plantar fascia problems are particularly resistant to change, and we need a gradual loading program. So obviously at the start, we look for pain relief. Needless to say, everyone wants that. We improve normal movement, so you're not hobbling around, get normal gait pattern back. Then we continue to build strength, okay? And if you're happy at that point and you're just doing walking and a bit of gardening and that's all you do, then you're fine. But we like to get people up to ability to run or hop, or if you're into a bit of dancing, you need to be able to do a bouncy, boppy movement, which is a lot more load through the plantar fascia. So we want to get you up to this running / hopping ability, whether you think you need it or not, and then you will be back to normal, okay? You continue doing all those things, okay, throughout the phases of recovery using our 5-step approach, and that's very, very important, very fundamental. And throughout this whole process then as well, you're going to make, it's never flawless all the way up to the top. You may feel a bit better, you might have a setback, it might level out, and then you might make a bit of progress, it might go backwards, level out, and repeat this up and down yo-yoing process over a number of months, okay? So this is months. Anything from 4 months would be an excellent outcome. Again, sometimes 6 months, sometimes 12 months plus. Okay, so let's be realistic about this. Real plantar fasciopathy is a tendon issue. Tendons are notoriously difficult and stubborn to rehabilitate. We need to gradually load them. We need to allow the appropriate amount of rest. It needs to be specific to your plantar fascia, your body, the way you behave, your lifestyle, and all the rest of those things. And that's where we can really help you. So if you feel you need more information on this, feel free to give us a call. We'd be delighted to help out. Move well, feel well, be well.